So, Harvey, coming to you from your experience, seeing the world over the years as it changes, would you like to share your opinion about the impact of AI on healthcare policy and regulation? Because you mentioned last time about HIPAA and different regulations that are in health. So, how do they change, or how do you predict those changes happening and be embraced by the people involved in the system?
Yeah, you see, that's a tough one. Because right now we're getting different angles. For example, Europe is regulating AI. California regulates it or looks at it a little bit different. And then in the United States, every state is looking at trying to do their own legislation. And so, big picture, I personally believe, kind of like the David mentioned earlier, we need to educate our physicians, our healthcare professionals, so that they understand how this AI works, or unravel the black box, because there's a lot of resistance to change. And unfortunately, some of these hospital systems will fight because they don't really understand, or they'll start trying to implement things that don't really need to be implemented, in the sense that it may be a tool that you don't really need. And if you don't consult the physicians or the nurses, they may not want to implement this. And so it's making it really interesting as far as regulation. The other part to this that I'm more worried is, I see a lot of developers using their own APIs and claiming to be quote unquote medical. But the things that they're doing will be crossed in front of the FDA that will make it look like a medical device. And so I'm cautioning a lot of the startups to make sure that they're looking at the FDA, looking at the regulation, making sure that they're not creating things that are going to create violations. And so it's a really interesting world we live in right now. But big picture, I'm glad to see big companies like Epic and Microsoft working together to create certain AI tools in our electronic medical records, and seeing a big wave of differences as far as this text to speech, speech to text, and that way in the near future, this keyboard that I'm looking at, I can throw it away when I see a patient and just have a normal conversation, and have that intimate conversation with my patients, and not look away at the keyboard but looking at my patient. So all these things, I think it's going to be interesting to see how it rolls out.